Hello everybody. My name is Andrea and this is Jeff. Today we are going to be talking about rec therapy and interprofessionalism. Like I said, my name is Andrea and I'm a junior pursuing recreational therapy at Grand Valley State University. I was born in Mexico and raised in a small town of Zeeland, Michigan for the past 9 years. I have loved everything about West Michigan, and that is the main reason I decided to study at Grand Valley. I love everything about West Michigan. Growing up, I was always interested in the healthcare field and medicine. Um, I always wanted to do something like nursing, but I didn't love the idea of just seeing one person at a time and coming and going. I like the idea of like getting to know somebody better and building that relationship and seeing the progress they acquired. So I had never heard of recreational therapy actually until the summer before going into my freshman year of college. I heard from a friend, so I decided to start doing all this research about it and seeing what it was about. Um, so in high school, I was part of a program called Zeelinks, and Zeelinks was a program that involved like one-to-one peer interactions in classrooms with like we help them with academics, like making sure that they turn in their homeworks and paying attention, taking notes, and all that stuff. And this program, I ended up like growing so much in it, and I became a leader. And in the end, I ended up being in classrooms instead of that one-to-one peer guidance, and that was what made me passionate about like advocating for people and working with people with disabilities. I wanted to see that they also got a say in things and that they are just like everybody else. So because of that, decided that recreational therapy was a really awesome like program, and like it fit everything of like the characteristics that I wanted to work on and learn about. So at Grand Valley, the program is awesome. I've been there for a couple months of semester, and it has been like awesome. You get a lot of like hands-on experience, and you learn a lot about disabilities. And I mean, I thought I knew it a lot already, but I didn't at all. So that is really cool. And you also learn about advocating more than like you maybe have been advocating a lot, but you learn a lot more and like doing it the right way and everything like that. Um, Not only like there's like amazing professors, but you also get to work with your cohort and like build those friendships and relationships with them and learn from them and learn those like awesome skills. Rec therapy is like the best career I could have picked. If you don't know like what you want to do, I encourage you to like research it and ask questions about it. So I'm on to Jeff.
Yeah, so I'm Jeff. A little bit about me is I'm 36 years old. I served 7 years active duty Army with 2 combat tours to Afghanistan and Iraq. I'm a single father. I'm divorced. My daughter is 10 years old. Um, a little more about me is I started college in 2014 at Northern Michigan College for automotive, where me and some friends opened up an auto shop. And I went inpatient therapy at the VA, and this is where I got introduced into recreational therapy. Um, this program absolutely changed my life, my aspect of life, my point of views on quality of life. Um, I came to Grand Valley in 2016, um, so I am a super senior. I love being around my veterans. I lost a lot of my veteran friends due to cognitive illnesses and suicide. So recreational therapy gives me that whole new perspective of life. And like what Andrea said is we become advocates. And one thing about me being here in Kent County for the last 4 years is I gained a lot of resources and community officials where advocating and resources are extreme in my book now. So I have a very good, solid relationship with my veteran community here in Kent County and with advocating with other resources for better of life for all individuals. I don't have very much experience with teenagers, juveniles, pediatrics, basically kids. So one thing that I would love to gain from this entire experience is working with kids more, but I really, really want and feel like my heart's desire is working with my veterans. Yeah, so that's a little bit about me in a nutshell. So with our recreational therapy, we have our 5 domains, which are cognitive, physical, sociology, social, and spiritual. Those are our backbones of life. Our cognitive is the way we think. Our physical is what we are able to do, what we are limited to do, and what we can do. The social function is everything that we need in life. We need communication with others. We need the support from others. We need to have the camaraderie and the friendships of others in our life. And our spiritual, basically, that's what it is in a nutshell. We have to be happy with ourselves. We have to find our own happy balance. We have to be positive with ourselves. We have to be spiritually known in order to progress in life. So these 5 domains of rec therapy to me are basically the 5 domains of a happy, quality, basic life.
So in the end, like recreational therapy is what helps you build these skills and become like have a better quality of life in the end.
Yes. So interprofessional approach, basically, and what happens here is different medical staff who work with the individual, it becomes a treatment team basically. So you have cross-sectional of medical personnel that want to better this person's life, and they look at all different perspectives. They look at the recreational therapy, they look at the pharmaceutical aspects, they look at the cognitive and the behavioral aspects of the life of the individual. And basically what they do is combine all of the good and all of the bad, and they build a perfect, almost strict lifestyle for individuals that can take life step by step and build them to be part of society and have that perfect quality of life. Implementing different types of therapies, cognitive, behavioral classes, depending on this individual, there could be substance abuse issues, there could be, home environmental issues, and figuring out across the entire board, instead of picking pieces by pieces, we have an entire treatment team that can absolutely work with this individual on cross-sectional of their entire life structure.
So yeah, pretty much like Jeff has said, this has to do a lot of with IPE, which stands for interprofessional education. So now in a lot of colleges, there has been this type of education enforced, and it is pretty much like it combines healthcare and social care students into like training with each other and coming like working with each other with like each other's professions to help and learn from other, like, I mean, it ends up like challenging students' perceptions on um, just their viewpoint on things. Like, let's say a nurse would do this, but a therapist would do this. So they come together to interchange ideas and everything like that. Also loss for multicultural aspects of treatment and care. So, I mean, like I said, it's coming together and it's all about teamwork. And then there is IPCC, which it stands for Interprofessional Collaborative Care. And that is pretty much putting it into work. Just what you learned as a student, just putting it into work, like working with other professionals to achieve like the optimal care that the patients or clients should have. So what this applies to recreational therapy is it's pretty much meeting clients' needs. Like as a rec therapist, you could work with a dietitian to see what a client needs to eat to be like reach their quality of life, or with a nurse to make sure that they're taking their meds and putting them into your plan. So like I said, like conducting assessments with physical therapist or occupational therapist, and putting in like your viewpoint with these other therapists to see what will make them reach their highest quality of life. Or there's things like group therapy, which with like a social worker, you can plan on implementing like leisure education and yeah, just making sure they reach their goals. So in the end, this IPCC and IPE, it's a new way of making sure the new workers are learning how to work with other professions and to give that patient or client or the person you're working with the best care that they deserve. So yeah, we have a reference page and
So yeah, kind of like what going on, Andrea, finding the best care and quality of life for the individuals is exactly the overall goal of the entire healthcare system, in my opinion. Um, you know, Working with other different practices, other different professions, we learn a lot about individuals, disabilities, dysfunctions, disformities, but we also get to work with that on our own cognitive and our own social aspects of life as well. So this is kind of like, in my opinion, the perfect circle of healthcare wheel. If we could implement this entire process across our entire healthcare, you know, I could see a lot better living standards for a lot more than what we are today.
yeah, and you might even learn some things from like other professions, like
Absolutely.
what they do. Like this is how they assess people, and like that could be a good way for us to assess them as well. You
Oh,
know.
absolutely. And then we also get a different perspective. Like, sometimes patients don't always tell doctors what's going on. You know, Sometimes you're going to find that patient's going to tell your behavioral therapist or your rec therapist or your social worker a lot more issues than what they're telling, certain medical staff or doctors, or if there's a patient who's having complications with medications, well, he's not going to tell the pain doc that, sometimes. So this also gives us a really good structure on how to communicate, associate, and develop ourselves with other professions and with the individual themselves.
So that wraps up our presentation. Really consider rec therapy as it like something you would want to do. I totally recommend it. It's awesome profession. But if you guys have any questions, don't be afraid to email us and let us know.
Thank you.